Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's episode is about anxiety among celebrities. According to the National Alliance on Mental Illness, or NAMI, anxiety disorders are the most common mental health disorder in the United States, affecting 40 million adults, or 19% of the general population. Celebrities are just as vulnerable as the rest of us. I'll talk about anxiety and stardom, as well as interview a psychiatrist for her expertise on this important health topic. Let's get started. Last week, actor Jonah Hill announced that he would not be promoting his new documentary, Stutz, at public events or press tours. The star of Superbad and Moneyball added that he spent nearly 20 years experiencing anxiety attacks, which are exacerbated by media appearances and public-facing events. Let's watch this clip to learn more.
Jonah Hill revealed that he won't be promoting any of his current or upcoming projects, citing his mental health. This episode of THR News is brought to you by Netflix presenting Squid Game for your Emmy consideration. Hill opened up about his decision while announcing his upcoming Netflix doc about mental health, titled Stutz, after his personal therapist, Dr. Phil Stutz. Hill noted that he spent nearly 20 years experiencing anxiety attacks, which are exacerbated by media appearances and public-facing events. His retreat from the public eye also includes his Instagram, which appears to have been deleted. He noted, "I usually cringe at letters or statements like this, but I understand that I am of the privileged few who can afford to take time off. With this letter and with Stutz, I'm hoping to make it more normal for people to talk and act on this stuff." In a 2021 story for GQ penned by his Don't Look Up director Adam McKay, Hill name-checked Stutz many times, opening up about how he started seeing his therapist in 2017 at the suggestion of his friend Joaquin Phoenix. "Netflix let me make a doc on therapy and Phil's teachings, and then it became about Phil's life, and then it became about how insane it is that I'm making a movie about my therapist, and now it's become, I don't want to give too much away, but it's become very collapsed on itself."
Tennis champion Naomi Osaka also shared her anxiety over media interviews, leading to her withdrawal from the 2021 French Open. At the time, she faced tremendous criticism. Many other celebrities have been open about their experiences with different forms of anxiety, such as generalized anxiety disorder and panic disorder. Lady Gaga, Ariana Grande, Ryan Reynolds, Selena Gomez, Pete Davidson, and Whoopi Goldberg are just a few of many stars who've publicly shared their anxiety. To dig a bit deeper, I'd like to bring in an expert on mental illness, Dr. Candida Fink, a practicing psychiatrist in New York State and a dear friend. Hello, Dr. Candida Fink. How are you?
Good. Very good. How are you, Dr. Lipi Roy?
Fantastic. Well, thank you so much for joining me. Folks, for those of you who don't know, this is my wonderful friend and a very, very smart, talented, successful psychiatrist here in New York State, my friend, Dr. Candida Fink. How are you?
I am well. Thank you so much for having me. This is such an important topic. So thank you so much for having me. This is wonderful. All the work you do is wonderful.
Well, and right back at you, my friend. I'm so impressed and with the work that you do, your years of clinical practice. Would you like to share with the audience a little bit about your work?
Well, I'm in private practice now. Been doing it a long time. Been 30 years this year since I started, and I've done all kinds of things. I've worked in all kinds of settings, inpatient, outpatient, but have been primarily outpatient for the last 15 years or so. And I do a lot of school consultation. So I see a lot of young people. I'm also child and adolescent boarded. So, that is a place we meet the kids where they are, and the adolescents, with their anxiety in school and how it's affecting schools. So that's really where my heart is right now. And in also trying to help get message out about accurate mental health information out on social media, because there's a lot of disinformation and bad information out there. So trying to speak to that in some places as well. So
And in your long career, taking care of like hundreds, if not thousands of patients, you've seen the entire spectrum of mental health disorders, from depression, anxiety, PTSD, bipolar disorder, the whole spectrum,
The
right?
whole anxiety, OCD, autism spectrum disorder, yeah, you name it. I've seen it.
Well, so this is why I think you're going to be such a great person to talk to about this topic. So let's just jump right in. Dr. Fink, why do you think anxiety affects so many celebrities? You heard about Jonah Hill, but
Yeah.
also Selena Gomez, Ryan Reynolds. So many celebrities have been very open and forthcoming about their experience with anxiety. Why do you think that is?
Well, first, I want to say it's amazing how much power and effect it has when a celebrity opens up about their anxiety. So I think that this is a tremendous improvement over the silence that has existed over mental health issues in celebrities for forever before this. So I think that's terrific. I think whether you're talking about a actor, musician, or a sports figure like Naomi Osaka, they are under the most amazing pressure that they have in terms that anyone can undergo. And it often starts young, especially with athletes, but even many performers, they start this work early in their lives, their young lives, their adolescent lives, they're digging in. And becomes this expectation not only to do great work, to keep producing. There are now people depending on you. You are, employing people and creating things that other people depend on. And it's also visible to the public. So there is so much about the work itself and being in the public eye that I think is extremely challenging. I also think that they, and I don't know too much about this, but it seems to me that they're isolated from the real world a bit and from their sort of grounding community, if only because they're working so many hours. And that's another thing. They work these like intense hours, or intense seasons, and then they have these real down times, which can be very hard. A lot of sleep, no sleep. And, I think that there's stigma. So they haven't, coming out about it, I think, is a long considered process. And in Jonah Hill's letter, how long he has lived with this and how much he has really sort of thought about whether or not to speak about it. In fact, now he's made a whole documentary about it, which I think is great. But, when Osaka first came out, it was like people were like, what? You have anxiety that affects your function? Public
And
speaking.
she was heavily criticized and
Heavily.
scrutinized.
Heavily.
I mean, she was shamed. She was, ridiculed. She was, how dare you? This is part of your job. But I feel like in a short time, things have kind of come around.
I think she was absolutely a mold breaker in that sense, because she knew what she was going to get, for all the reasons that we can imagine why she was particularly, targeted. But and it was something that she had to take care of very quickly. She had a very specific fear of public speaking. I mean, this was not, oh, I don't feel well. This was anxiety that really devastated her and harmed her and made it hard to function. And it was courageous of her, because she knew what was going to happen. And I think she opened doors for people.
Well, your insights are so key. I think you raised a lot of really key points, which is that a lot of them start the celebrity world of celebrity at a really young age. Some of them are childhood stars. The amount of pressure that they face from traditional and social media, things going viral, any little small mistake gets amplified, unlike the same mistake you and I might make. Right. And the fact that you pointed out that they are actually employers. So many people, even in their inner circle, depend on them financially for their own paychecks, so to depend on them to perform, and that all of that can create anxiety, right?
Absolutely. And even if haven't been famous since they were young, they've been hustling since they were young. We don't see all the years. And of course, sports, athletes they train like crazy their whole life. They usually give up regular school, like a dancer, they give up regular school. So we don't even see all those years of intense demand. I think that it's just certainly another piece that, if you don't mind me jumping in on, that is, just broadly talking about criticism and meeting demands, we have to mention specifically body demands, whether you're an athlete or an actress or maybe less musicians, I don't know, but I don't think so. And certainly in the dance world, like your body is under everybody's view, and maintaining a certain body image and size and weight becomes crucial to the whole endeavor because of our horrible fat phobic stigmatizing world about different bodies being okay. So that in itself, so they're hungry and they're tired most of the time. So I think that in itself would make anxiety so much more likely.
And you pointed out that they don't exactly have, I'm guessing, 9-to-5 jobs, right?
No.
And if you're a musician on tour who's performing from 8 to 11 p.m. or midnight,
That's
and you're
right.
on a bus and a plane,
That's
I
right.
mean, so all of these things, you pointed out so many key aspects that are risk factors for anxiety. And just so everyone is clear, all viewers are clear, Dr. Fink, anxiety is part of it's a spectrum of different types of disorders, which is in fact a mental health disorder, which is a disease. It is not a sign of moral weakness or failure.
Absolutely not. This is a mental health issue. It's part of brain health, and it's a very common disorder.
Yeah.
About 1 to 2 in 5 people in any one year will have an anxiety disorder, and the numbers are bigger for sort of lifetime. It's a very common disorder, and it is part of brain functioning, and brain and body. It's the brain and the body all connected. And while we're talking about celebrities here, but we it affects people of all ages, in all settings, of all, wherever you can come from, whatever you do for a living. It certainly is a problem for so many people.
Thank you for pointing that out as well. It transcends race, gender, ethnicity, all comers.
Sorry, 100%.
So now, Dr. Fick, I would love for you to describe as a psychiatrist, what are your recommendations for treatment and care? Somebody who has anxiety, is it hopeless? What are their options?
So there's so many options, and the good news is it's a very treatable disorder, and range of disorder. Severities range, right? But it is treatable. And the first thing is absolutely asking for help, letting someone know, speaking about it, making it spoken. If you think you may be anxious, you don't have to be like, you have to say, oh, am I anxious enough? Or am I having enough problems to tell someone? If you have enough to think about, maybe I should tell someone, right? If you're having enough worry or enough anxiety or sleep problems, you're thinking, go ahead and let someone trusted know. And so that's huge. And then in terms of getting help, there are, our 2 primary interventions are psychotherapy and sometimes medication. Certainly not everybody needs or takes medication. That's appropriate, but there's a range of psychotherapies, in particular cognitive behavioral therapy, dialectical behavioral therapy, that are particularly well studied and we know to be extremely helpful for anxiety. On top of, or sort of more an umbrella over clinical treatment, there are many things you can do to work on managing anxiety in your life day to day. Getting enough sleep, as we were just talking about, making sure you're eating when you're hungry, staying connected to people that you love, and doing fun things, and taking breaks from your work life and the things that do worry you. Movement that feels joyful. I hesitate to even use the word exercise because it can sound punitive, but find something movement that feels good in your life. And if you could, a version of mindfulness, it doesn't have to be meditation, but some kind of mindful practice, we know also has a lot of wonderful research around how helpful it can be for supporting anxiety. And for some people with milder anxiety, taking care of those sort of life type, it's not even lifestyle, that sounds a little superficial, but life story things, putting those together, and putting those in your life, and asking for help from those around you, friends, For many people, that is plenty to help manage milder anxiety. But if it's not getting better, ask for help. Or you're so anxious you can't do those things. And that's okay too. Like a lot of people will say, well, why don't you just exercise? I went, sometimes you're so anxious you can't get out the door, or you're so anxious you can't make a decision to do something. So don't feel like you have to wait until you've tried every non-therapy or medication thing to ask for help. I guess that's
You are so helpful in just breaking down the different categories in terms of what's evidence-based, medical, psychiatric treatment options. But you also talk about, for lack of a better expression, lifestyle or other very effective and also evidence-based strategies such as mindful practice. I think this is where folks like psychiatrists like you really intersect and overlap well with internal medicine and former primary care doctors like me in terms of like nutrition, exercise, sleep, mindful practice. All of these things help overall health, specifically mental health and physical health.
So mental, physical, it's all one human, it's all one body, it's all one organism.
Exactly. So I cannot begin to tell you how thrilled I am to hear your expertise and now be able to share your expertise with all of the viewers. I am so grateful to you, Dr. Fink.
It's been absolutely a pleasure. This is a wonderful conversation and such an important topic. So
thank you. Thank you so much. Have a good day.
Take care. You too. Bye-bye.
I am so grateful to Dr. Fink for sharing her expertise on mental health. Key points to remember are that anxiety can affect anyone, all races, ethnicities, genders, regardless of socioeconomic status. It's easy to judge from a distance and say, oh, they're rich and famous and beautiful. They don't have real problems like the rest of us. Remember, unless you're truly walking in their shoes or you're a close member of their inner circle, you have no idea what your favorite actor or singer or athlete is going through. Let's also not forget, celebrities are people too. They have feelings. They experience problems with their families, their personal health, their jobs, their finances. But unlike us, everything they do is observed and scrutinized under the very public microscope of media and paparazzi. So every mistake they make is amplified and then potentially shared among millions of strangers worldwide, and then subject to massive criticism and ridicule. And for a young person whose brain is still developing, this type of harsh exposure can have damaging effects on their mental and emotional health. And it can lead to self-destructive behaviors like addiction to drugs, alcohol, food, and lead to eating disorders, depression, and other psychiatric conditions. But the good news, and this is another key point made by Dr. Fink, is that help is available. Reach out to a trained professional for medications, therapy, counseling, and taking care of your overall health through proper nutrition, sleep, exercise, and mindful practice can help reduce stress and anxiety. Self-care is so important. So let's all practice empathy. Put yourself in a celebrity's shoes. Ask yourself, would I want my embarrassing mistakes plastered all over the news or social media? Be sure to take mental health seriously. There is no shame in seeking help. If you had a broken leg, you'd get help for it, right? So do the same if you have a broken brain. So how can you get involved? Learn more about mental health from, donate to, or volunteer with trusted sources like mentalhealth.gov, the American Psychiatric Association, the American Psychological Association, the Child Mind Institute, the National Institute of Mental Health, or NIMH, the National Alliance on Mental Illness, or NAMI, the National Eating Disorders Association, or NEDA, the National Suicide Prevention Lifeline, SAMHSA, the World Health Organization, and many more. Well, that's all for today. The show will be on a hiatus for a couple of weeks as I travel to Europe to speak about addiction, COVID, public health, and media. In the meantime, here's your joke of the day. What do you call a farm that makes bad jokes? Corny. Be sure to subscribe to my YouTube show, make comments below, and follow my Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.